In this video, I'm going to be looking at some of the evidence around resistance training and its relationship with longevity as well as quality of life. This is a topic that I'm super passionate about, having worked for many years as a personal trainer, much of the time with older clients. I was able to witness firsthand the tremendous impacts it could have on their level of function, their ability to enjoy life. In this next few minutes, I'm going to be going over some of the impacts that it can have on our likelihood of developing certain diseases, as well as our quality of life and overall function. So on this first slide, I have that question posed: why do we lose our independence with age? And by far the biggest reason is the inability to perform basic functions without fear or risk of injury. One of our biggest enemies is frailty, and that usually stems from the loss of lean muscle mass, strength, and also bone mass. And I've tried to illustrate that in a visual way in these three pictures here. On the left side, you have a cross-sectional view of the thigh of a 40-year-old triathlete, someone who's very active. What you see on that outside ring is the layer of subcutaneous fat, that layer of fat that's under the skin that all of us have. And then beneath that, that darker gray is muscle tissue, right? That's the quadriceps and hamstring muscles. And then in the very center, you see that bright white spot. That's the femur, the thigh bone going through the middle. Moving over to the center picture, you have an image of a 74-year-old sedentary man. And what you see is what unfortunately happens with sedentary aging, where you have a dramatic reduction in the amount of lean muscle mass and an increase in the amount of adipose tissue, the fat tissue along the outside. In addition, that muscle mass is permeated with what we call intramuscular fat. There's veins of fat running through it. And you can also see that the femur at the center is much smaller and somewhat discolored, indicating that there's been a loss of bone density. And unfortunately, many people regard this as inevitable. One of my biggest frustrations is when I hear folks in their 30s, 40s, talking about how their bodies are falling apart and treating it as if it's something that is inevitable and that there's nothing they can do. And that's simply not the case, and that's demonstrated very plainly in that image on the right-hand side. So this is another male, also 74 years old, but also a triathlete like the guy on the far left. And you can see that it looks equally as good as that image on the left-hand side. Thin layer of subcutaneous fat, plenty of dense muscle tissue, and a well-developed dense femur at the center. So all this to drive home, there is tremendous potential for us to delay the worst effects of aging through appropriately applied exercise. And that's what we'll be getting into. But first, let's talk about some of the risk factors for disease and mortality that are affected by resistance training. So on this slide, we're looking at resistance training and its relationship with all-cause mortality, death from any cause, right? So cancer, accidents, cardiovascular disease, etc. So the first thing that was found in this meta-analysis, this review of multiple studies on this topic, they found that any amount of resistance training, however little, reduced the risk of all-cause mortality by 15%. Risk of cardiovascular disease mortality was brought down by 19%, cancer 14%. And if people increased their amount of resistance training up to 60 minutes per week, 2 30-minute sessions or 1 hour-long session, that risk of all-cause mortality went down by 27%. So just looking at the broadest overview of risk of death, resistance training is an incredibly powerful tool in extending our lifespan. Let's look at diabetes risk and glucose control on this next one. So interestingly, strength training in this study was shown to be superior to cardiovascular training for reducing HbA1c or blood sugar control. Our muscles act as sort of a sink or a repository for blood glucose in the form of something called glycogen. And if we have more skeletal muscle, then we essentially have more places to put glucose when it comes into the bloodstream after a meal. And that's also reflected in this other conclusion of the study, that increased muscle relative to fat was an independent predictor of HbA1c. So basically, if people had more muscle and less fat, their blood sugar control was going to be better. We also want to talk about depression and anxiety risk. This is another thing that is endemic in our culture, unfortunately. And certainly when we're talking about aging, if we're not mentally healthy, if we're not able to enjoy life, which is one of the first symptoms of depression, is the loss of ability to experience pleasure, then that's going to have a tremendous impact on our overall quality of life. What these studies have found was that resistance training was actually better than medication at treating mild to moderate symptoms of depression. And even in people with clinical levels of depression, diagnosed depression, they were able to see strong and persistent benefits that lasted long after the study period was over, when they were followed up with at 26 months. People often forget that our muscle is also an endocrine organ. It plays a big role in our hormone function. And many of the hormones that are produced during resistance training exercise have strong antidepressive effects. So as we're looking to not just maintain our physical health, but maintain our cognitive and mental health, resistance training is a really powerful tool. Resistance training and cognition, right? Many of the folks that I speak to, that's one of their primary concerns. They want to be able to keep a strong level of cognition as they age. I personally experienced this as I saw my grandmother age and experience dementia. And this study had two groups. One was a control group that did band exercises and stretching, and another group that did resistance training that specifically focused on power production. So they were instructed to try to move the weights quickly, which has particular neurological benefits. And what they saw is that there were improvements in mild cognitive impairment, that kind of not yet dementia, not yet Alzheimer's, but reductions in things like reaction time and recall that we see with age. They saw reductions in risk of developing dementia. And their causes here are likely multiple factors, but one of them is a marked increase in what's called brain-derived neurotrophic factor, which is a compound that stimulates the development of new neurons in the brain. Some of us may have heard at some point this idea that you're born with a set number of neurons and those gradually die off as we age, and there's no replacing them. And that's been found to be false. Your brain does in fact make new neurons, and it certainly makes new neural connections. And resistance training is a big stimulus for that production of new neurons and new neural connections. We see increases in cerebral blood flow to the brain, as well as improvements in neuroplasticity, which is that ability of the brain to form new connections, which plays a big role in our ability to acquire new skills. We also see lower rates of white matter atrophy. So our brain tissue and white matter can decrease in size with age, but that is very much slowed by the implementation of resistance training. So let's talk a little bit next about the way that this occurs in practice. How do we train in such a way as to build muscle mass, and in such a way that is going to allow us to fend off some of these worst effects of aging for as long as possible? So on this slide, we're looking at something called the stimulus recovery adaptation cycle. On the left-hand side, you have a scale of numbers going from 0 all the way up to 30. And this is just an arbitrary scale to reflect an individual's current level of ability, their current level of strength in this case. But we can apply this to a lot of different types of adaptations we might want to acquire. So let's say I'm at a level 10 in terms of overall strength. If I want to get stronger, if I want to build new muscle, I want to increase my bone density, I need to train at a level that is pretty close to the upper limits of my ability. Maybe not all out failure where I can't physically complete another rep, but pretty close, an 8 or 9 out of 10. And what's going to happen as a result of that hard training, that training that is challenging to my current capacities? Well, in the short term, I'm actually going to get weaker, and that's a product of fatigue. In the short term, right, if I try to complete that same workout again the next day, I might not be able to because I'm sore and fatigued from that initial training session. But that training provides a stimulus, a signal to our body to produce the desired adaptations. And then as we recover, as we sleep, as we eat a healthy diet, as we eat plenty of protein, if we manage our stress, we're able to not only recover from that training back up to the level where we were previously, but we're also able to realize adaptations beyond that. And this can be achieved well into old age. So now I have a higher level of ability, I've recovered from my training, and now I can repeat this process by training that muscle group or whatever skill it is that I'm trying to get better at again. But now I have to train at a higher level. I have to use more weight or do additional reps or find other ways to increase the degree of stimulus in order to send that signal to provoke adaptation. And that process continues. Fatigue, then recovery. We recover back to our previous level of ability and then adapt to exceed it. So on paper, this sounds pretty great. It would be like being able to drive your car really fast down the highway and then park it for a few days, and next time you take it out, it can go even faster. The cool thing here is that this process of stimulus, recovery, and adaptation, we can apply it to any ability that we want to improve upon. This could be a cognitive task, it could be a flexibility challenge, it could be our cardiovascular ability, or it could be our muscular strength. But in order to provoke a physical change, our current capacity has to be challenged in some way. Whether it's our range of motion, whether it's learning a new skill, whether it's building muscle or adding bone mass. But this is challenging for an important reason, right? So let's look at that stimulus, recovery, adaptation cycle again, but how it unfortunately plays out most of the time. So let's start out, say I'm earlier in life, I've got a decent amount of strength and muscle, I'm a level 30. But my exercise and training, if it's happening at all, isn't happening consistently, and I'm not really training at a level that's sufficient to challenge my current level of ability. It's not even sufficient to maintain it. And so over time, with aging, my strength capacity decreases. Maybe I'm not sleeping that great, I'm not eating enough protein, my stress is high. All these things will accelerate that rate of decline. And eventually, I may find myself in a situation where I need to call upon a certain amount of strength or power in order to prevent injury from happening. Maybe I need to brace myself against a fall. Maybe I've lost my balance. Maybe I've spontaneously decided to play a pickup game of basketball and overestimated my abilities, and I get injured. I exceed my level of capacity. And in the immediate term, we see an immediate reduction in our overall level of function, our ability to move around and do a variety of different activities. And you see that reflected on the graph there. You know, I go from a level of 10 ability to even lower. Now I'm down at 5. I'm half of what I was able to do before. Now, if we properly applied that stimulus recovery adaptation cycle, I would start to try to train at a level that was not so high that it exceeded my capacity and got me re-injured, but high enough to stimulate adaptation so that I could start to rebuild some strength and some muscle over time. But unfortunately, what usually happens is that there's a tremendous and understandable fear of re-injury. And there's an avoidance of tasks that are challenging or ranges of motion that might be painful. We want to stay far away from those upper limits so that we don't find ourselves in that same position again of getting injured and losing even more function. But because of that process of decline continues, and often at a more rapid rate. What we see is after significant musculoskeletal injuries in older populations, there's very frequently a rapid rate of decline following that. And so this is where having a good coach, a good trainer, can be really helpful in overcoming that level of fear associated with challenging oneself, maybe in the first place, prior to injury, or if injury has already taken place, finding that new upper limit and training at or near that so that we can start to recover some lost function. It's important to find someone that has a level of empathy, that understands how this process works, understands that your fear of re-injury is understandable, it's reasonable, but that training close to our current level of capacity is going to make us more resilient against injury and not less. So with that, I want to go over a few takeaways and then one final analogy. So as we're starting this process, we want to make sure that we identify any fears or stigma around resistance training or limiting beliefs that might hold us back from committing to a resistance training program. Maybe it's a fear of injury. Maybe we're not sure if it's safe, when in fact it's going to, as I said, make us more resilient against injury. Maybe it is a fear of getting too bulky or looking like a bodybuilder, which is extremely challenging to do. It's not going to happen by accident. Another important takeaway here is to understand that our relationship with pain needs to be well understood. So when we experience pain as we go through the aging process, it's important to understand that pain does not equal damage and damage does not equal pain. What do I mean by that? Well, typically our perception is that if a joint hurts or we're experiencing some kind of pain, it's an indicator that I'm hurt. Something has been damaged, something is wrong, and I need to stop doing that thing. And sometimes that may be the case in the short term, but that's not a one-to-one correlation. Pain can be provoked by a wide range of circumstances. And very often the solution to it is more movement, not less movement, not simply laying off of it or resting it. Also, damage does not equal pain. So an example of this is in people with herniated discs. So there's a mountain of evidence showing in imaging data that people that have had herniated discs for years in their lower back can be symptom-free and have no low back pain whatsoever. Sometimes we might have imaging done and find that there is some kind of structural issue going on, like a herniated disc, and that can create limiting beliefs around what we're capable of and prevent us from engaging in certain kinds of activity or utilizing certain ranges of motion. And it's simply not a one-to-one correlation. This could be a whole talk on its own, but it is important to understand that often the solution is to continue movement, maybe in a different way, maybe with less load, but not to simply lay off of movement and avoid it entirely. We want to regularly spend time moving through a variety of joint angles, particularly end ranges of motion, where our joints are fully stretched, whether it's reaching overhead, whether it's fully bending at the elbow, getting into a deep squat position. If we can do that against resistance, even better, where we are performing our weight training exercises with a full range of motion, taking our joints from end range to end range. Another takeaway here, we actually need to increase our protein intake as we age. So when we eat protein, we have an increase in what's called muscle protein synthesis, the process of building muscle essentially. As we age, our muscles become less sensitive to that intake of dietary protein, so there's a smaller increase in muscle protein synthesis after a meal. So we actually need to increase our protein intake as we age in order to get the same effect as we did when we were younger. A good starting point is to try to take your healthy body weight and 80% of that in grams of protein. So 200-pound person aiming for 160 grams of protein. Most of us are not getting close to that number. I'm aware of one statistic that the average American female gets about 70 grams of protein per day. And unless you weigh about 90 pounds, right, that's not going to be enough to optimally preserve skeletal muscle. And lastly, getting sufficient good quality sleep is an amazingly strong preventative of injury. When people that get more sleep have much lower rates of injury than folks that get less sleep. And it also is when most of our recovery takes place after training in the gym. So if we're trying to build muscle or lose fat, all of those things are going to happen more easily if we're getting adequate, good quality sleep. Last analogy here. So most of us, as we're thinking about aging, we're thinking about retirement, and we're thinking about having enough money and be able to enjoy our retirement and maintain the standard of living that we want to. Most of us understand that the earlier in life you start investing, the easier it is to have enough money saved up for retirement. If I start investing at age 20, $100 a month, well, if I wait until age 40 to start investing, in order to get to that same amount of money that the 20-year-old investing $100 a month got, I would have to invest around $800 a month, assuming a 10% rate of return is about average. So the analogy here is we should equally be thinking about having enough skeletal muscle laid aside in the bank, so to speak, to preserve our quality of life as we go through retirement. And obviously, the sooner we start, the easier it is. But if we are starting later, that's okay. We can still get there. But it may take some more effort to get to a place where you can build sufficient lean tissue to be able to really enjoy your retirement years and have a high standard of living throughout the majority of your life. So I hope this was helpful. You can find me on social media at Stephen Schelt Coaching or on my website at stephenscheltcoaching.com. And please feel free to comment below if you have any questions or you want to share your own experiences around resistance training and healthy aging.